Depth class. This is part 2 of our series with the NCLEX review test taking strategy. Read the question carefully and tell me, what do you see? You have to see something. If you don't see it, then you can't answer the question. But if you see it, the answer choice is easy. What is the question is asking you? I like to read it from the back so that I can see what the examiner is basically asking me. Okay. At 6 months follow-up, which of the following findings should indicate a need for what? Medication adjustment. Which of these should indicate the need for medication adjustment? That means I need to do something. This should tell me something is not working or is working too much. That's all. You see concept? I know what I'm looking for from the last portion of the question. Whether what I'm doing it excessively or I'm not doing it at all. So I need to adjust the medication in any way. A 35-year-old female client was recently prescribed what? 50 microgram of Levothyroxine by mouth daily. At 6 months follow-up, which of the following findings should indicate a need for medication dose adjustment? 3 lines, just make it easy. What is being asked, make adjustment. So some adjustments need to be made. And what is the case in the buzzword? It's basically a patient is on Levothyroxine. You have to recognize this medication and tell yourself, you see, I'm not looking at the answer choice. I tell myself, who in the world will be taking Levothyroxine? There's only few people. Me and you will not be taking Levothyroxine unless you have some underlying medical problem. Nobody will go and take this medication. It's not good. If an athlete is taking that, well, he's going to be in trouble. So who in the world will be taking this medication? Think about it. And you ask yourself, what is the medication used for? Who? I did not tell you that because I want you to think. That's part of the critical thinking the board will give you. Just like prescribe the medication, and then you have to figure it out. You know this is a thyroid hormone. There's only one person who needs thyroid hormone replacement. Either their thyroid is not working, or we have removed the thyroid. So in any case, it has to be somebody who is hypothyroid. So somebody who has hypothyroidism or they have thyroidectomy, yes, you make them hypothyroid. So every patient who needs hypothyroid, who is hypothyroid, needs some form of thyroid replacement. So levothyroxine, I call it thyroid replacement. That's all. It's a thyroid replacement hormone. That is what it's used for. So it's a thyroid replacement hormone. So if you're on levothyroxine, you're getting thyroid replacement hormone. Before you answer the choice, you say, okay, if I'm hypothyroid, what are my symptoms? Everything is going to go up. My symptoms will be upgoing, right? My symptoms, okay, what is going to happen is my symptoms weight is going to go up and the rest goes down. That means they gain weight and the rest of their symptoms all go down. In any case, they gain weight, but what? Things slows down. They become bradycardic, they have constipation, dry skin, they can't tolerate temperature, cold temperature, all those things. So that's what I expect in this somebody who is hypothyroid. If you're hypothyroid and I give you levothyroxine, I'm replacing your thyroid hormone. So your symptoms should level up. You should not be losing weight, gaining weight anymore. You should not to be having cold intolerance. You should not having constipation anymore. Your heart rate should not be going down. So the signs and symptoms of hypothyroid should be normal. I should normalize it. That is the concept the examiner is trying to let you know. If I give you 50 milligrams of levothyroxine, I'm suspecting you are hypothyroid, and your symptoms, which are symptoms of hypothyroid, should be normal. You should act like a normal person. That means the 50 microgram of levothyroxine should be exactly what every normal person is having. Right now, you're having normal thyroid hormone. So your heart rate is not low or high, you're not gaining or losing weight, you're not having heat or cold intolerance, you're having a normal life. You are not hyperthyroid and you are not what? Hypothyroid. You see the thing? That is where you break down. Therefore, if I am hypothyroid, this is where it comes in. So let me make it easy for you. I'm hypothyroid. You give me levothyroxine, I should be normal, right? If I'm going too much, my symptoms are signs of hyperthyroidism is bad. If my symptoms are hypo, that means I'm not doing a good job as a doctor. So the only two things you can adjust the patient medication is when they have hyperthyroidism symptoms or hypothyroidism. That means you need to give them more medication if they are hypo, or if they are hyper, you need to cut down the medication. That's what the question is asking you. Once again, 50 milligrams of levothyroxine in a patient who is taking it for 6 months, you should see them normalize their symptoms. Which of these indicate adjustment? If you're having tremor, it means what? What does it mean? You are hyperthyroid. I don't want you to be hyperthyroid. I want you to be normal. So this is bad. If you have cold intolerance, think about it. That means you still hypothyroid after 6 months of the medication. That means what? I need to make some adjustment. So this is also bad. Rapid weight loss. That means you're losing weight. You were hypothyroid and I give you levothyroxine, all of a sudden you're losing all your weight. That means you are what? Hyperthyroid. I don't like it. I want you to be normal. You should not have tremor. You should not have cold intolerance. You should not have rapid weight loss. If you have high heart palpitation, what are you doing? You are hyperthyroid. I don't like it. Now, this is something you have to know because they like asking. Okay, the TSH, I intentionally bring it in. If you don't know it, then you need to check it out and click on endocrine, made easy, simple, straightforward, free videos. You just ace your endocrine. Look, your thyroid hormone, thyroid gland secrete T3 and T4. Your TSH stimulates the thyroid hormone to make that. If you have low level of T3, that means you are hypothyroid. Your TSH, you get mad. It said thyroid hormone, make more T3, T4. So your TSH goes up. If you have high level of T3 and T4, TSH said, I'm not going to make any more thyroid hormone. Therefore, TSH goes down. So when your TSH is high, it tells me you're still hypothyroid. This patient has been taking thyroxine for what? 6 months. The TSH should not go that high. It should normalize. That is why we check it every month to make sure our TSH is normal. If it's high, we give you more medication. If it's low, we cut down the medication adjustment. So when you see a question on the thyroid hormone patient, this is what they would do. This is all concept I'm trying to tell you guys. Like, there's nothing to it. It's the same concept. You have to know the concept, then you can apply it. Therefore, if I see TSH of 7, it's too high. It means the patient is still thyroid deficient. After 6 months of 50 milligrams of levothyroxine, we got to pick this one too. So all the 5 answers are right. What did I do? I just used the endocrine concept to answer it. But how did I do that? I went and targeted the question, pick out the buzzword, know the concept I need to know. If you don't know, then you be just selecting something you're guessing. I told you, you get to like figure out what the examiner. This 35-year-old patient has been taking levothyroxine. I never tell you what it's used for. In 6 months, what you find is which of these do you make an adjustment? You have to go back and say, hey, what is levothyroxine? What is it used for? It's hypothyroid. And therefore, when I'm taking levothyroxine for hypothyroid, I should act like a normal person. Therefore, if I see any symptoms, that is signs of hyperthyroidism, I need to make adjustment. If I'm seeing signs and symptoms consistent with hypothyroidism, I still need to make an adjustment. How do you know that? Look at the symptoms and know which way you go. Hypothyroid patient, most of their symptoms is going to go down except weight. Hyperthyroidism patient, most of their symptoms will go up except what? Weight. Their weight goes down and their symptoms go up. So this is the only way you can answer this question. All of them are right. But you can see it's a straightforward question. No tricky, but just concept that you got to figure out. And if you figure out, you'll be able to answer it easily. Right. Number 2. Don't tell me this is hard. This one is not hard. Select or apply. I just change words that you're usually familiar with. And you said they're very deceiving. No. Which of the following findings the nurse should anticipate on assessment? What is the buzzword there? Anticipation. I should be able to see this when a nurse is caring for a 4-month-old. It's a kid suspected to have what? Bacteria meningitis. You know this. You've read about this. You know everything about meningitis. Now use whatever you know to answer the question. This is why not just knowing the thing, but bringing that concept, the little thing you know about meningitis, 1 or 2 things you can tell me that any patient with meningitis, what you worry about and why we treat them, and you use it to answer the question. That's all. And what you worry about meningitis? What are the things you worry about? It's inflammation of the brain, right? But the most serious thing about it is when the brain gets inflamed, you have ICP issue. And if they have ICP, they can go into seizures. This is why we treat them. That's all. You see what I did? I did not talk about all the signs. I just used this. This is the main concept of meningitis. That is why we're treating you. The brain is framed. We don't want your ICP to go up. That's why all the things you do when you're taking care of them is to prevent ICP increasing. You put them in the quiet environment. You elevate their head of the bed. You place them in the lateral position so that they cannot have seizures. All the things you do is consistent with that. Therefore, which of these indicate that when you examine them, you're going to see that? I changed the word. You know this, right? Usually when you read the book or you watch some video, they tell you high pitch cry. It's the same thing. High pitch cry, what is it? Consistent with that. Cranial suture separation. What do you think about it? Your cranial suture. The sutures are part of the skull. When you look at the skull, there's a parietal suture, there's a frontal portion, there's a temporal and occipital. That is the line between those bones. Okay, this is the sutures, the line between them. Okay, you have the temporal, parietal, frontal, occipital, the line between them. When there is too much pressure in your brain, the sutures separate. Okay, the sutures will separate. So cranial suture separation, I can change this and I put this, what? Bulging fontanelle. This is the same thing. If you take the test and you see cranial suture separation, you say, oh, I've never seen it before. Is there another word for it? Think about it. Bulging fontanelle is the same thing. When the sutures separate, the fontanelle comes out and it bulges out. Signs of ICP. Number 3, otitis media. There's a word recent. Any upper respiratory infection or ear infection is close to your brain. It can go, this is why we treat you with the ear infection in kids, so that it does not cause osteomyelitis. It go into the bone or go into your blood and then pass the brain blood barrier and it causes meningitis. Recent infection. If you don't know, just leave it. There's some clear one you can pick, right? So this is also a possible thing you can see in this patient. Fixed downward gaze. Does anybody know this? If this is the individual patient and this is their eyes, fixed downward gaze is here. Their eyes is here like that. This look like an ET or something like that. But fixed downward gaze. Have you seen it? Another word people use for it? Fixed downward gaze. It look like ET, but yeah, ET in the different form, but fixed downward gaze. What do you call it? What do you call it? There's another word for that. Somebody tell me. Fixed downward gaze. What would some people book will call it? What we call the sunset eyes. It's the same thing. Sunset eyes. You've seen it before, the sunset eyes. So that is the fixed downward gaze. They're looking downward. That's evidence of ICP, sunset eyes. And of course, fever is a given. You can see fever, right? What other things will give? The most common one, I intentionally put this question. I was just like trying to thinking about a way to get you guys be more think about stuff. And I'm picking answers that you are not familiar with, but you know it. I'm using different words. Of course, another thing the examiner can give you is vomiting. That one you know, right? Poor feeding. And it makes sense. If you vomiting, there's no way you want to eat anything. You're going to have poor feeding, right? Feeding intolerance. That's what people usually would describe it. So it's consistent with that. If I'm vomiting, I'm not going to be eating, right? I told you about the fontanelle, bulging fontanelle or intense fontanelle. They may have lethargy. I know everybody will pick that. That's why I never put it there. Okay? I never put it there because everybody know about it. They may be grunting. I don't want to put it there because everybody will pick that one. I talk about high pitch cry. It's the same as street cry, right? They will have what? Irritability. That's what everybody know about. I don't want to give you that. I give you another word for it so that you can figure out irritability. You can also use straight cry. Basically, they're not happy about it. But these are the common ones everybody know. That I don't want to use the easy ones so that the hard ones you say, oh, what are you talking about? It's the same thing, right? So you know it, and then I'm using certain words to give you the question. But what is the key concept? What am I trying to do? 4 months old with bacterial meningitis, what should I expect? I tell myself, bacterial meningitis, I'm looking for signs of ICP. That's what I'm worried about. But the easy ones is easy. They're going to have fever. That's fine. But what are the signs of ICP? Vomiting, poor feeding, lethargy, grunting, irritability, shrill cry, which is high-pitched cry, suppression of the suture is the same thing as bulging fontanelle, recent otitis media. Any upper respiratory infection or ear infection can go into the blood and cause a problem. Downward face gaze, sunset eyes. We all know when we see it, we think it's a buzzword, but they can change it and put these words there. It's the same description, fixed downward gaze. And of course, they have fever. This is Adapt NCLEX. Thank you for watching. Like I told you, test taking skills. If you master it, you see that NCLEX will be a breeze. But keep charging as always. If you need more, check Adapt NCLEX. We have great videos. You can join our membership. Thank you very much for your time and spending with Adapt NCLEX. All the best of luck. Bye.